if you're doing these liver gallbladder flushes, there's only really one standard one. Using the salt waters, that's stupid. That's it. You don't want to do that. One lady was in here, she said, I just about ended up in the ER doing the salt water, and I said, nobody recommends salt water consumption. Some things you just got to think out, you know, and I know that people want to trust other practitioners, and I say that same with me. I try to think everything out and make sure that I've had some experience or someone has before I'm going to put any stamp of approval on anything, and some things are just common sense you don't do. I'm not familiar with Andre's liver gallbladder flush. I'm real cautious about too much, and I've said this before, overstimulation, overspasming of tissue. It's okay if you really, you know, do it once or something or twice to pop some of the bigger stones and get that out. But just the natural, you're actually in this health modality here. You're actually reversing why you're getting stones. You get stones in an acidic medium where you dissolve them in a base medium. And I tell you what, I don't overly do liver flushes because I think it's important to spend 2 or 3 months cleaning your body out before you do a liver flush, even though a lot of the stones will already be dissolved and coming out. Some people have rather large stones, and I've only seen one case where the lady had one that couldn't come out. But remember, when you're flushing, you're spasming. And sometimes, if your liver isn't real healthy, you have a hard time pulling back out of that. So just stay on the raw, get up on the fruits, man. Keep flushing that liver. Take the liver gallbladder for me. Just clean out that liver, and you'll be good. 17 liver flushes. I think you've done enough. You know, liver flushes is spasming the liver, and you really don't need to do any more. The liver isn't a detoxifying organ. Keep that in mind. It's a chemical manufacturing plant. So be cautious about overstressing the liver with coffee enemas and stuff like that. Not the way to get well. You know, the way to get well is pure chemistry. You don't have to overstimulate something and think you're going to shake it and make it do better and things like that. You're after the health of every individual cell in the human body. I've seen pieces of liver from a liver flush coming out of the stool as well. And this is the thing, is these liver flushes, don't overdo them. I mean, don't overdo some things. Some people are having trouble because they've overdone liver flushes, and it's like, what are you trying to do? Keep spasming the liver. You know, if you pop out a few stones, okay, but then go after the lymph, because remember, the liver is just a bunch of cells and 2 major fluids. Should we use Epsom salts for liver flushes so that the stones won't lodge? These are soft stones. I've never seen anybody do a liver flush that really had stones lodge. But I really recommend you do raw and the liver formula and some herbs and clean your lymph system and clean yourself up a couple months first. Your gall flushes will work a lot better here. I never use the Epsom salt, so I couldn't tell you about it. And then there's that magnesium citrate a lot of people use. I don't get into that, spasming the liver. And you should never lose your gallbladder because of stones. Those are easy to clean out of the body. But you don't want to do a liver gallbladder flush when you have high elevated liver enzymes. You don't want to do anything like that because you have a lot of inflammation, and the liver gallbladder flush is spasming the liver a little bit. You don't want to do that. You want to kind of get all that inflammation out first, because going on a raw diet and going on liver herbs, liver gallbladder formula bars and stuff, it'll reduce the stones and pull them out. Just that alone will do that. You know what? I would detoxify the body for a little while before I would do a liver gallbladder flush. You know, use the liver gallbladder herbs, clean up the gut, get the kidneys to filter, things like this. If you have stones, they're going to start going away anyway. They're going to start melting away, because you're creating a cationic environment when you start an alkalizing process. And so you're gonna have all this inflammation back down anyway. You're gonna stop forming stones, and then do you a simple liver gallbladder flush.